Okay, hello Dimensions class. As I promised, just your live lecture will consist of this review for exam 2, and there will be a hidden word in the middle of this recording, so that will be what you will submit to Dropbox. So stay tuned. This will only benefit you for the exam as well, and I will try to keep it short and to the point. And I'm sure that you've all been studying a fair amount already. So just a couple topics that I want to touch on. The things that I'm going to try to touch on and review are things that you will not only see multiple times throughout the exam, but also really will bring a lot of value to you in your clinical setting, in your current workplace, or as working as an RN as well. So I really want to make sure that we're hitting on things that are kind of the hot topic in healthcare in current state and also future state as well. So as we talked about different topics during these modules, we talked a lot about legal and ethical issues, advanced directives, being a legal document, and this is something that we as nurses sometimes can get a little confused on because we're not attorneys. We have a passion for helping people heal and for holistic care. And in giving excellent nursing care. So sometimes when it gets into that type of legal framework and that sort of thing, it is nice to kind of have that at the forefront as to an advanced directive actually being that legal document that states a client's wishes about their health care. And it is written up in case of an unfortunate circumstance where they are not able to make that decision, for themselves. So very, very important. It's something typically when you're admitted to the hospital that is part of an admission questionnaire typically, depending if you work in a religious-based facility. I work in a Catholic-based ministry. We actually have pastoral care on site that will come and fill that out with people at the time if they so desire and express that need. So it is very important. We want to make sure that people's wishes are followed through on, and we don't want to slight or to make decisions that may not have been what the patient would have wanted. So very important. Advanced directives can get kind of sticky. It is a tool that we can certainly use and helps the patient determine what they want and helps them have a voice for times when they may not be able to actually have a voice. So very important there. As we talk about nursing, and we touched on some really great thoughts in some discussion posts as well with critical thinking and how that's really the frontier of your practice as you gain all of the theory and the clinical components throughout school. That critical thinking is sometimes that next level. So it's very important, and it is very important because of the fact that the patients that we care for are not one-dimensional. They many times will have many comorbidities and many health problems going on, along with maybe some social issues and things of many different types of nature. So we need to be able to think very globally and put all the pieces together. Thus, critical thinking is really the tool to do that, and that's why we really drill on the nursing process as well, because it will help kind of guide that critical thinking process. They work together to definitely improve our practice. Now, as you become a more experienced nurse and have some time and experience under your belt, you'll find that critical thinking piece will kind of become second nature, but certainly nursing process remains definitely a key component in that as well. So nursing practice, critical thinking being part of our nursing practice, and then it also just jives with our nursing process and is based off of that as well. In order to critically think, you need to be able to think purposefully and also be able to reason and reason through different things and do that in a very controlled manner. You can't be real impulsive. So you have to be able to really kind of reason through lots of different problems and lots of different issues to look at what is best overall. A might be here, B might be here, and C might be here. But how do we solve them so that we can bring resolution to A, B, and C, or maybe better resolution to A and B? Kind of always weighing things out. That's part of, that critical thinking process as well. There's things that you will think in your nursing career. There are what we like to call subjective judgments or subjective thoughts. Those are not things that you would ever put in the chart. So always remembering that everything that you put in the chart would need to be objective. The only thing that you may chart subjectively would be something that the patient would say, and you'd want to put that in quotes. Say, for example, you're charting a pain scale, and you would want to put in there, patient states, the pain in my right hip is burning and throbbing worse than it was yesterday. Subjective, because it's so, can change compared to what was yesterday. So then you'd have to look back and that sort of thing. So that's why it's really nice to have more objective charting, such as 0 to 10 pain scale, those sort of things that would be set forth in a hospital policy. But you certainly never want to put any of your opinions out there or thoughts. That would not be the place to do that in that patient's chart. So, and that's something that as you focus on your SBAR charting, your SBAR report, or, depending on what facility you work at, if they still do like SOAP notes or whatever that charting structure is, it's kind of built around helping you to not be subjective in your charting. We talked a lot about nursing theorists and nursing theories. So just remembering that many of those theories are very old. However, when I say old as to when they were developed. However, remembering that they really never get old or dated if they're good. Because if they're good, they should be flexible, realistic, and usable. If they're too rigid, then they will get dated and they won't persevere. As healthcare changes, the theory is not going to be able to change with healthcare. So very important to note that as well. Please do a review of Jean Watson. And things that she felt strongly about as far as her clients and the importance of the family and the spiritual beliefs. And then also what did she think was important in the practice of nursing. So please review some of that with Jean, also Emma Jean King, and Betty Newman as well. So just some of those high level. Getting back to a little bit, we talked about legal and ethical a little bit, and just also remembering that some of those verbiage, some definitions of some of those words that you read about and that we may have talked about in some discussion posts. Really, what does non-maleficence mean? And making sure that we're not doing harm to any clients, and having some good understanding of all of that jargon. Also, euthanasia is a word that we hear a lot about. There's passive and there's active. What is the difference? And how does that align ethically? Did the patient wish for that? Is that something that they wanted? And that kind of goes back to our initial conversation with advanced directives as well. And I'm just going to put a little plug in here for the code word. The code word is going to be competence. So just go ahead and use that for the assignment, competence, okay? When we talk about meaningful use, that's something that's really in the spotlight right now with how